talk tonight is the talk on health. And on the platform of Richvision Cooperative, we have brought something that we believe that everyone, both our members, our friends, need to hear about. And I am so glad that tonight we have someone who will be the best person that you could find anywhere to talk about this. But before then, I just quickly want to let you know, during the course of this presentation, if you have any question, please quickly just write it down, because there will be room for questions to be asked after the presentation. So please make sure you write your questions down correctly. But before then, let me tell you that this is a platform for like-minded people. We are all entrepreneurs on this platform, the Richvision platform. We have close to 1,200 membership in our platform, and we are all entrepreneurs. Here in the cooperative, what we do is that we save and we earn at the same time. So it's always a pleasure for those people that have been part of us to be able to share what we have been enjoying for the past 3-4 years now. I just want to really clear some information before we go to the presentation. The explanation that you're about to hear tonight is concerning our health. And for many of us, what we are familiar with is the issue of out-of-pocket financing of our health management. Many of us are familiar. Some of us, we are used to a different system where you do not need to have cash to be able to finance your health issues. Many deaths have been recorded because of mismanagement. Many families have been put to situations they don't need to be. And all is just because of information. Tonight, we brought that information to you. We have done what we thought a lot of people need to have done in the past. We want you to know that your health is more important than even those things that you are focused on right now. And today, we have someone who will help us to gather our thoughts together, open our eyes to the opportunities that is available to every one of us, not just for the rich, for every one of us in Richvision and also our friends. Tonight, I have a medical doctor. He's also a technocrat. He's a fellow of the Institute of Health Insurance and Managed Care of Nigeria. And I want to tell you, it was the first time when I was viewing his profile, it was the first time that I got to know about such an organization. He's a member of the Chartered Institute of Management as well. And I also want to let you know that presently he's a Deputy General Manager with the National Health Insurance Authority. And these are the people that have been put in place to manage the administrator of health insurance in Nigeria. So what we have here is the person that you need to talk to. So I want you to relax right now. If you can get a piece of paper and a pen, because the information that you are going to hear is information you need to keep, not just for yourself. You need to share it eventually with people around you. All right. So, ladies and gentlemen, if you can, because I am going to bring him up right now. We have limited time tonight. I have with us tonight Dr. Abraham. His full name is Betuel Kasimu Abraham. Is someone that when I met him, I thought all the issues about health around me will be solved. And I think you are going to feel that same way tonight. Ladies and gentlemen, if you can just put, as we usher him in, just type 555 so that he can know that we are ready for him. So you can just type, Dr. Abraham, you can unmute yourself right now. The whole house is clapping for you as you come in. You will see 555 coming in shortly. So let's type in 555 in the chat room just to welcome Dr. Abraham. Dr. Abraham, okay, the floor is yours. If you can just test the mic right now for me to confirm your mic is still muted. Okay, your mic is still muted. I don't know whether you seem to have been frozen.
Yeah, I think it's network.
Okay.
I could see
Wow.
in and out.
All right. Is it coming back in? Oh my. Tonight is too important for this network not to cooperate. All right, just let's hold on for Dr. Abraham. He will join us shortly. As he's doing that, let me just quickly let us know some of the mistakes that many, he's back, he's back. You can just unmute yourself. All right, Dr. Abraham, just test the mic. Let's hear you.
Good evening once again. I hope I'm audible to everyone.
Yes, you are now. Correct.
All right. As you've heard already, my name is Dr. Abraham. The other name you've not heard is Betwe Kasimu. I work with the National Health Insurance Authority. I head the Ikeja State Office. And I'm very happy to be making this presentation to this group. I have been a member of a cooperative before, and I'm still a member of a cooperative. And I know the benefits of belonging to a cooperative. What we're here to, I've been invited to talk about is health insurance. Now, before I talk about health insurance, there are two things I want to quickly talk about. One, I'll just give you a definition. The other one, I'll give you a story. For the definition, WHO has defined health as a state of complete physical, mental, and social well-being, and not just the absence of disease. Now, when you talk about complete physical, mental, and social well-being, what is simply saying there is you don't wait till a morbidity shows up or till you are stopped from working by a disease entity before you realize that you're sick. Now, you don't wait to the point of ill health before you begin to make arrangements on how to take care of yourself. Nobody prays for ill health. No. But should it happen, it should not in any way wreck your financial life, wreck your economic life, and wreck your plans for your life and for your family. Having said that, I will take you to the second story. And that is the story of a European country on how they came about the health insurance that they have today, that almost 100% of the country is covered by health insurance. Now, before in the advent of the 19th century, the particular country I'm talking about is Germany. They had their workers who worked in these were workers that were not working for government, they worked in private organizations, worked with mining companies. Now they mined different minerals from the crust of the earth. Now they discovered something over time, that if any of their members takes ill, such an illness will wipe out whatever savings they had made in life. And they decided to do something about it. Not all of them would come in with a condition that is linked to the job that they were doing, but they could not tell who among them was going to fall ill. And if that person fell ill, it will wipe out his entire savings, and the person will not be able to work again to earn money to take care of his health. So they decided, okay, that they were going to be putting funds together. They started contributing monthly, putting funds together, and they called it sickness funds. That was what they called it, sickness funds. So they would work and everything. They had good time together, nice time together, a community of miners. And if any of them takes ill, they take that money and take care of the person. And the person recovers, get back on his feet, and continues with the group, with the organization. And so they continue saving and saving and saving again. And it was only a matter of time that the government noticed this thing these guys are doing that is beneficial to them. Is there a way we can extend it to other organizations? And they brought in other organizations to come and learn what these miners were doing. And they learned what the miners were doing and decided each organization started their own sickness funds. And the results were tremendous. And the government of that country decided that, okay, all workers were going to come together and have these sickness funds. And that was where health insurance on national scale began globally. Up till date, they still call these sickness funds, but it had grown so big that government workers, private workers, everybody now contributes into the sickness funds, knowing that should they take ill and they are not able to earn money to take care of themselves, there is a fund somewhere that takes care of them, helps them to recover and get back to work and continue to earn to support their families. That second story, I told you that story to impress on you the importance of having, in quotes, a sickness fund somewhere in the event of any eventuality. You know, there's somebody that said something. He said, in Nigeria, you may say you are not poor, but only one event of sick health, of illness, of ill health, can send you from not being poor into the poverty level. We don't pray for that. That is why the essence of having health insurance is become very, very important to every one of us. The government has noticed this. WHO, World Health Organization, has noticed this and have decided it was only proper that we had mandatory health insurance in all nations of the world. Nigeria joined in the year 2022 when health insurance was made mandatory by a law of the National Assembly that was passed and was assented by the president at the time on May 19th, 2022. So Nigeria today has a law that makes health insurance mandatory for every citizen. The reason for this is so that should you take ill, there is a fund somewhere that will be used to take care of your health, to help you to recover and get back on your feet and get back to productivity for your family and for the country. It also helps to improve our national indices when it comes to health. Now, one of the objectives, there is what we call BHC.
Let's just give him few seconds to reconnect. He must be having major connection challenge where he's located. Just give him few seconds to reconnect. Right. Okay. I think he's back. Where is he now? Ooh.
I hope I'm audible.
Yeah, you are back. You are back.
All right. Now, with health insurance having been made mandatory, compulsory in Nigeria, the question you now want to ask is, how do we get this health insurance? You can get the health insurance from the government entities that have been made mandated by law to provide that health insurance for you, which is NHIA and the state health insurance agencies. Now, should you need more than what these bodies provide, then you can get it private health insurance from the HMOs. Now, the ones that are provided by the government agencies like the NHIA is called social health insurance, which is akin to the sickness funds I mentioned earlier. In social health insurance, what you contribute or the premium that you pay is not based on the risk that you come with. In private health insurance, it is based on the risk that you come with. The reason is not far-fetched. Social health insurance provided by the government is not profit-based, while private health insurance is profit-based. So I will explain what I mean by premium being a function of risk so that you understand. In social health insurance, when you're coming to join the social health insurance to contribute into the fund, what happens there is, even if you have, say, diabetes, hypertension, and all that, nobody is going to say because you have diabetes and everybody is contributing X amount, you are going to contribute X plus 7. Because you have hypertension, you will contribute X plus 10. No, it is not risk-based. But private health insurance is risk-based. They say, okay, because you have a pre-existing condition like hypertension, like diabetes, if everybody is paying X amount, you will pay 2X because you are going to use more money than others. That's private health insurance. That's not social health insurance. Now, for the social health insurance that is offered by the NHIA, it is contributory in the sense that you make a contribution into what you enjoy, into a common pool. Now, this common pool is going to aggregate funds from a lot of people, like members of this group. It will aggregate these funds, and when any of the members fall ill, money will be taken out of that pool of funds to take care of the person. How do we do this? It is by programmed contributions. This programmed contribution is done through our program we call GIFSHIP, Group Individual Family Social Health Insurance Program, GIFSHIP, GIFSHIP, Group Individual Family Social Health Insurance Program. Now, this program has made it such that when you come as a group of more than 10, you'll be coming to pay 15,000 naira per person per annum, which is per year. That's the amount that you will pay, and you will enjoy access to healthcare when you fall ill or if you fall ill, and you'll be treated. Now, if you want to come as an individual, it will be 45,000 naira. When you want to come as an individual, it's 45,000 naira per person per year. But when you are coming as a group, it is 15,000 naira per person per year. And then it even makes it worth the while. If you are coming as a group that is ready to pay for you and make deductions out of whatever contributions you have made in like a group, like a cooperative. So it makes it easier for you. You don't feel the movement of that money out of your pocket. Now, what this goes to achieve is when you go to the hospital, you don't pay out of pocket. The benefits you're going to enjoy, I will come to that shortly. And if I'm allowed to share my screen, I will share my screen so that you see the benefits that you are to enjoy by being an enrollee. We call you enrollee. Once you enroll, we call you an enrollee. To being an enrollee of the GIFSHIP program. Now, this GIFSHIP program is nationwide. What it simply means is that when you are enrolled, let's say you enroll in Lagos, and you have a business assignment that carries you to Abuja, and while in Abuja, you take ill, there are NHIA accredited facilities in Abuja that you can walk into, and you will be taken care of. because you are enrolled on this program. Probably you have a assignment that takes you maybe to different states of the federation. Maybe you have an assignment, you have a team working in Abuja, another team working in Niger State, and another team working in Edo State at the same time. Should any of them fall ill, even though the hospitals they chose to use is in Lagos, they will be taken care of in those states where they are by going to any of the hospitals that are accredited by the National Health Insurance Authority, and they will be taken care of. So these are some of the things I want you to see that makes you strategically poised to enjoy healthcare benefits by enrolling on the NHIA giftship program. Now, how do you get to register? Now, normally, if you come as an individual, you walk to our office, we'll tell you, you pay the 45,000 naira, and then we'll register you. If you have other family members you want to bring, maybe your spouse, for you and your spouse, it will still be 45,000 naira. But then if you have more than 3 persons, and let's say you have up to 4, 5, 6 as a family, yes, for 6 persons it's 90,000 naira. For 5 persons, 75 to pay for a whole year's access to healthcare. But when you come as a group, it is 15,000 naira per person per year. And the group can decide to pay for everybody, and with time, make an arrangement with them on how to make these deductions that have been paid on their behalf. For example, if your cooperative pays 15,000 naira for you, the cooperative can arrange with you and say, okay, every month we'll be deducting 2,000 or 3,000 until we have deducted that 15,000 naira. So that arrangement can be made so that you don't feel the impact of the 15,000 naira that left your pocket. But when you look at the benefits that you're going to get, I'm telling you that impact of 15,000 naira leaving your cooperative account is not going to be something that you will consider. In fact, you will consider it very worthwhile. First and foremost, when you want to go to the hospital, you won't think about the money you are going to pay when you're going to go to the hospital because you're already enrolled. Secondly, when you get to the hospital, you're not going to pay for card. If I ask some of us here on this platform, how much do you pay for card in the hospital? Some of us will mention an amount that is already more than 15,000 naira. Yes. So, and as an enrolled person on giftship, you don't pay that in the hospital. Another thing you don't do when you are enrolled is you don't pay for consultation. Yes. You don't pay for consultation, you get to see your doctor. And so because you are not thinking of these costs associated with accessing healthcare, you don't, whenever you have a headache, you don't think twice before going to the hospital to check yourself up. A lot of the healthcare behavior, healthcare seeking behavior that we see that are not appropriate, majority of it is a function of financial access. People don't have the money to go and access healthcare. And so what do? They access those who are close to them, selling traditional herbs or some drugs that they've, I don't know what to call it, that nobody gauges what amount is safe for you. And so we see abuse of all these drugs that are out there. And instead of going to the hospital to see professionals, you are damaging your health the more by accessing these services. So I want to quickly let you know what the benefit is. I would love to share my screen so that you see what this 15,000 naira is getting you in 1 year. And probably after, let's see this.
Yeah, you can go ahead to share, sir.
All right, thank you. Okay, is my screen visible?
Yes, it is.
Yeah. Okay. Now, the program I talked to you about is the gift ship program of the NHIA. And what I want to reel out to you now is the benefit package. I'll try and be as fast as possible because I've been told how long you spend in your meetings. Now, this benefit package is what we comprises the services that are defined by NHIA as what you enjoy, having been made enrollees of the gift ship program. And you become an enrollee when you pay, you register, you pay, and your name comes out in an register as one of those that will access healthcare. Now, what you stand to benefit, I want you to look at the list of all these specialties in medicine that is listed here. These are some of the specialties that are covered under the NHIA. From the one on your left, you talk of primary care, talk of general surgery, internal medicine, O&G, pharmacy, laboratory, pediatrics, radiology, dental service, psychiatry, orthopedic surgery, physiotherapy, ENT, that's ear, nose, and throat, optometry, ultrasound scan, ophthalmology, electrocardiography, what we call ECG, endoscopy, urology, dermatology, neurology, cardiology, nephrology, neonatology, maxillofacial surgery. These are all covered, are all specialties that you can access care from once you become an enrollee under the gift ship program of the NHIA. The benefit package that you will enjoy is the same benefit package that I enjoy as a public servant. It's the same benefit package you will enjoy. The NHIA benefit package cuts across 3 levels of healthcare. Now, when we talk about 3 levels of healthcare, we are talking about healthcare at the primary level, secondary level, and tertiary level. Healthcare at the primary level is mainly preventive care. Now, this preventive care that is offered is what will help you to stay healthy, to keep fit. Now, whatever is at that level, whatever is beyond that level, you will be referred as an NHIA enrollee to the secondary level. In the secondary level, you are treated of whatever disease condition that you were referred for from the primary level. If it cannot be taken care of at the secondary level, you will be sent to the tertiary level. Who are the primary level providers? Non-specialist private hospitals. We have a lot of them. In Lagos, we have about 2,000 or over 2,000 healthcare providers. Then the government PHCs. These are also primary level providers. At the secondary level, we have the general hospitals and the specialist private hospitals. They offer specialized services to enrollees that are referred from the primary. Then at the tertiary level, at the teaching hospitals and the specialized hospitals. So when we talk about the teaching hospitals, we talk about LUTs, LASUTs, and then the specialized hospitals, the orthopedic hospital, the psychiatric hospital. These hospitals provide care at the tertiary level, and you will have access to care at these levels when you are a gift ship enrollee of the NHIA. Now you say, why do they have to refer me from one level to another? The reasons for referral is this. There are cases that an enrollee may have that is complex, and your GP, not that your GP is not sound, not that your GP is not competent, but the complexity of the case will require that a specialist look into the case. For such, you will be referred to see a specialist. Complexity of the case, that's one reason that referral is done. Another reason referral is done is competence of the personnel that are attending to you. If the competence of the personnel do not match the disease condition that you have, you'll be referred to where the competence is available. And then the capacity of the healthcare facility. Sometimes the healthcare facility has the competence, but the capacity, maybe it's a 10-bedded hospital. They don't have capacity to take more, but they can handle your case. They can refer you. Sometimes it may be the equipment that is needed. They have the radiologist on ground, but they don't have the MRI. They have to send you to a place where they have the MRI. And so that is capacity limitation, which can be a reason why you can be referred. So these are the reasons why referral is done from one level to another. So the benefits. Let me quickly run through the benefits. Outpatient care, the one where you go to see a doctor, they treat you, he takes your history, he asks questions from you, he examines you, and maybe he orders for 1 or 2 investigations, and then makes a prescription, you collect your drugs, and you go home. That's what we refer to as outpatient care. This you will enjoy as a gift ship enrollee of the NHIA. Laboratory services are there, pharmaceutical services are there. Emergency care, this you also enjoy as an NHIA enrollee. In fact, you know you're going to, when you come in, you're going to choose a hospital that you'll be using. When it comes to emergency care, it is not a function of the hospital you chose. God forbid, if, for example, you are in let's say you stay in Ajangbadi, and you went to the island to go and do a job, and while doing the job, probably an accident happens. You take you to the nearest NHIA accredited facility, and you tell them you are an NHIA enrollee, and you will be taken care of. That is not the hospital you chose, but because it is an emergency, you will be attended to. That is the emergency care we are talking about. This is different from the out-of-station care that I talked about when you travel to another state, maybe to execute some business. Surgical procedures, these are covered under the NHIA. Now, from simple procedures like drainage of abscess, wound debridement, simple laceration, when there's a tear on the skin and you have to sew, let me use the word sew, we call it suture, you suture it back. Paronychia, the one you have a boil on your finger, they have to take care of it. Circumcision of the newborn, passage of urethral catheter, these are the surgical procedures that are covered. There are more complex procedures that are covered that if I display them here, over 300, you will be surprised. Appendectomy and a lot of other ones that are covered under surgery in the gift ship package. And then sexually transmitted infections, these are covered. Obstetrics, under obstetrics and gynecology, we have common disease conditions like acute PID, pelvic inflammatory disease, vaginal discharge, and all this. Now, these ones I'm mentioning are the ones covered under primary care, where your GP can provide these services for you, whichever hospital you choose to provide primary care for you. Eye care, your GP can provide a treatment of conjunctivitis, what you know as Apollo. Then simple contusion, abrasions, and foreign body in the eye. These can be taken care of at the primary level. Dental care education will be given to you by your primary care provider, by your GP. Now, if it needs if you require a dental condition to be taken care of, you will be referred to see a dentist, and you will still be covered under the NHIA. Now, when you are referred from one hospital to another, it is still the NHIA that will be responsible for your treatment. NHIA will still cover that treatment. It doesn't mean once you are referred from your hospital to another hospital, your business with us is off. No, we'll still cover the service you are referred for under the NHIA. Then mental health, including psychosomatic illnesses and insomnia. Now, somebody had said before, well, ill-advisedly, that NHIA does not cover mental health. I said, no, NHIA covers mental health. You have a reason, maybe you're stressed up. Maybe you have a situation that making you overreactive. You can go talk to your doctor. You can go discuss with him. He may be able to tell a thing or two about what's going on with you. You have insomnia, you cannot sleep, or you sleep very poorly. Go and see your doctor. These are mental health conditions that can be taken care of before it becomes something full-blown that nobody will want to have. So NHIA covers mental health conditions. Child welfare services is covered at the primary level. Family planning services is covered, but in family planning, we don't give you condoms, we don't give you femidons, we don't give you all those things, but we give you the education. Now, antenatal care, this is covered under the NHIA, and the investigations associated with antenatal care is also covered. I will come to what we cover under the laboratory services. The routine antenatal care drugs are covered. Immunization for the pregnant mother is covered. Maternity care, where both delivery and postnatal care is covered. Cesarean section is covered, but not at the primary level, it's covered at the secondary level. Now, once as an enrollee of the NHIA, every child you give birth to is covered for the first 12 weeks from the date of birth. I want you to get that very clearly. Every child you give birth to, until the child's name is not in the register, the child is covered using your own insurance package as a gift ship enrollee. Under secondary healthcare, specialist consultation. Your GP refers you to see a specialist. This is covered under the NHIA. You will enjoy it as a gift ship enrollee. High-risk pregnancies. Now, you're doing your antenatal with your GP at the primary level, and your GP now high risk pregnancy. It will refer you to the obstetrician. What we mean by high risk pregnancy is a pregnancy that puts the life of the mother at risk. That means this pregnancy, if it is not carefully watched, if it is not carefully followed, if it is not carefully attended to, we may lose the life of the mother, or we may lose the life of the baby. So these high-risk pregnancies include a first pregnancy, a first timer. When it comes to pregnancy, is a high-risk pregnancy. Then somebody, the fifth child, that pregnancy is a high-risk pregnancy when you have already had more than 4. Then a pregnancy that is carrying multiple gestation, twins, triplets, is a high-risk pregnancy. Then a pregnancy where the pregnant woman is bleeding during that pregnancy is a high-risk pregnancy. A pregnancy for a woman who in her last delivery, she had torrential blood loss. That means she was bleeding during that pregnancy torrentially. It's possible it can happen in the current pregnancy, which makes the current pregnancy a high-risk pregnancy. So high-risk pregnancies are covered under the NHI. As a giftship enrollee, you get to enjoy that if you have a high-risk pregnancy. Then emergency gynecological procedures. Somebody has an ectopic pregnancy, is covered under the NHIA. Or somebody has a spontaneous abortion and they need to take care of it, it is covered under the NHIA. Now let's go to pediatric. Pediatric cases are covered under, when we say pediatrics, we mean child health, the care of a child who is sick. Pediatric cases are covered under the NHIA. Then pediatrics condition that requires a surgery to correct is covered under the NHIA. And then we go to eye care, refraction. When we say refraction, it means you need lenses to correct the way you see, and that is covered under the NHIA. Now, that includes provision of low-price spectacles. Now, with NHIA does cover contact lenses. So it's good I let you know that. Some of us may not know what contact lenses are. I will explain. Contact lenses are those kind of, you see some people where they open a small container and they bring something that is transparent and put it inside the eye. It serves as eyeglass, but it's put inside the eye, it makes contact with the eye. That's a contact lens. NHIA does not cover that. ENT cases, ear, nose, and throat, what we call otorhinolaryngology, is covered under the specialist. You'll be referred and you will see one. Then radiography, when we talk about X-ray, ultrasound, MRI, this is covered under the NHIA. Still on secondary care, under dentistry, scaling and polishing is covered under the NHIA. Root canal treatment, replacement of dentures, these are covered under the NHIA. Then under physiotherapy, the care you need under physiotherapy is covered under the NHIA. Pardon me, I'm rushing because I'm looking at the time. And then tertiary health care. Remember earlier I talked about tertiary level of care, the teaching hospitals and the very specialized hospitals, LUT, LASUT, orthopedic hospital, Ibobi. These are specialized hospitals that provide a kind of care that you don't just find anywhere. Now, any case that you have that cannot be handled at the primary and the secondary level, we go to the tertiary level and NHIA will still cover it. Now, what don't we cover? As a giftship enrollee, what can't you enjoy under the NHIA? Now, occupational injuries are not covered as a giftship enrollee. What do we mean by occupational injuries? You work in a place where there is a machinery, that a big machinery maybe that processes cassava or grinds it and so on and so forth, and accidentally you put your hand inside the machine and the thing cuts off the hand. If you're an NHIA enrollee, that immediate care that you need will be given to you, but after that it will not be covered. Why so? Nigeria has a law, the Employee Compensation Act, where companies are supposed to make contribution to the NSITF, so that if an employee suffers that kind of damage, from that fund they will take care of the employee, because sometimes if it's a for the rest of his life, so they will have to compensate the enrollee. That is beyond healthcare. That is taking care of the economic ability of that person. So that is not covered under the NHIA. Injuries resulting from natural disaster, let's say there's earthquake, there's landslide, once we have that, it is not covered under the NHIA. There is a reason why. Conflict, when there is riots and there is war, a lot of people are wounded or a lot of people are injured. That is not covered under the NHIA. Epidemics, something like Ebola, Lassa fever, COVID-19 is not covered under the NHIA. These things I've mentioned that I said is not covered, you will notice a common trend that runs through them. A lot of people are affected at the same time. Once this happens, health insurance, social health insurance globally does not take care of things like this. Government sets up a fund that takes care of it. For the epidemics, you have heard of the Nigeria Center for Disease Control, NCDC. They take care of that. Now, family planning commodities like condoms and femidons, NHIA does not cover it. And so you will not be enjoying it as a gift ship enrollee that will give you condom or will give you femidon. No, we will not have that. But the family planning education, you will get it. Injuries arising from extreme sports. What do we mean by extreme sports? Sports that you engage in that are very high risk, raises the adrenaline. And a good example is car racing. If you feel you have eaten enough and you decided you and your friend go to Third Mainland Bridge and decide to do car racing and you are involved in an accident, NHIA will not cover you because you are engaging in an extreme sport. Horse racing, polo, mountaineering, NHIA does not cover injuries that result from that. Luckily, we don't have a lot of these in our country. Then surgery, mammoplasty. I know you know what that means. Okay, somebody wants to do breast enhancement. For crying out loud, you are not doing it because of ill health. You are doing it for other reasons of aesthetics. So NHIA does not cover that. Multiple keloid excision, NHIA does not cover that. So these are the total exclusions. I will still go for more. Drug abuse and addiction. Somebody is taking cocaine, and because of the cocaine he's taking, he has problems with addiction. He has withdrawal symptoms when he wants to stop. NHIA does not cover that. That will be taken care of in the specialized hospitals that have been provided for that. Domiciliary visit, where you want the doctor, the nurse to visit you at home and treat you at home, NHIA does not cover that. So as a gift ship enrollee, your doctor will not come and visit you at home and treat you. Your nurse will not come and visit you at home and treat you. Under ophthalmology, we don't cover contact lens. What I mentioned before, that transparent lens that you put inside the eye to make contact with your eyeball so that you can see clearly. We don't cover contact lens. What we cover are spectacles. Under pediatrics, we don't cover congenital anomalies. There are babies that are born where the esophagus, which name will I use that? The gullet or the throat is linked together with the breathing tube. When it is linked together at birth, the surgeries to correct that, NHIA does not cover that. Remember I told you the newborn baby will be covered, but if the newborn baby has this, NHIA will not cover it because it takes multiple stage surgeries to correct it. Atrial septal defect, when a baby has hole in the heart, NHIA does not cover this to correct it. Then under O&G, artificial insemination, maybe a couple has challenge with fertility. They are married, they are not getting pregnant. That infertility, the aspect that requires artificial insemination like IVF and ICSI, NHIA does not cover it. Then dental care, we don't cover crowns and bridges. We don't cover bleaching of the teeth. No, we don't cover implants, any kind of implants. NHIA does not cover it. Then pathology, post-mortem or autopsy, NHIA doesn't cover. Now, these are total exclusions. Let's go to the partial exclusions. Partial exclusion means we will cover some parts and you will pay for the remaining parts. Under partial exclusions is what we refer to co-insurance, where the enrollee pays 50% and NHIA will pay the remaining 50%. Now, this partial exclusion used to be 2080, where the enrollee pays 80% and NHIA pays 20%. But when we saw the need and that people were using these services more, NHIA decided to make it 50-50. So, what are the services under this partial exclusion? High technology investigations like CT scan, like MRI. These NHIA pays 50%, the enrollee pays 50%. Dialysis for acute renal failure or for chronic renal failure to a maximum of 6 sessions. NHIA will pay 50% for the dialysis, the enrollee will pay 50% for the dialysis. All endoscopies and laparotomies is 50-50 because these are what? High technology investigations. Drugs under partial coverage using NHIA tariff. Now there are some drugs. These drugs previously were not covered by NHIA, but we saw that there was need to cover these drugs because they were being used more often than not. And so NHIA included it in their tariff. Some of them are as expensive as up to 400 naira per tablet. So NHIA says, instead of allowing enrollees to suffer this way, let's take 50% of the cost and let the enrollee pay 50% of the cost. Fix those combination drugs used in diabetes and hypertension. NHIA covers them. Then partial coverage for cytotoxics. You may be surprised to hear NHIA covers cancer, the treatment of cancer. And NHIA has gone to the extent of negotiating with companies, pharmaceutical companies that produce the drugs for treating cancer, made a negotiation with them to say that, okay, we will take 50% and the enrollee is supposed to take 50%. But because these drugs are very expensive, you, the producer, will want you to take 30% of the cost so that NHIA enrollees will only pay 20%. And they agreed, and we have signed a memorandum of understanding. So if somebody has a cancer, under the cancers that are covered under NHIA, the person will enjoy these benefits if the person meets the conditions. I will mention the conditions at the end of this presentation. Meropenem, this is a when other antibiotics have failed, they fall back on this antibiotic. Now, this antibiotic is as expensive as up to 10,000 naira per ampoule, per one ampoule of that injection. Now, NHIA says instead of taking 50% and you pay the enrollee paying 50%, the company that made the drug has agreed with NHIA, signed an understanding that they will take 40% and the enrollee will only pay 10% of that. And this arrangement exists in certain hospitals across the country. I will list out these hospitals you are looking at here. So when somebody has a cancer that NHIA covers, in these hospitals we have made arrangements that 50, 30, 20 that we told you about, we apply here. Ahmadu Bello University Teaching Hospital, Aminu Kano Teaching Hospital, Kano, Federal Medical Center, Gombe, National Hospital, Abuja, University of Benin Teaching Hospital, University College Hospital, Ibadan, University of Nigeria Teaching Hospital. So the person will be referred to any of these hospitals so that the person benefits from that cost sharing arrangement that NHIA has put on ground. Now, what qualifies you as an NHIA gift ship enrollee to access this care? You must have been an NHIA enrollee for at least 1 year. You must have been an NHIA enrollee for at least 1 year. Not that somebody with cancer and the person runs this. No, you must have been and have access to that. Then you must have been referred by an NHIA accredited that your primary provider discovers you have such a condition, he refers you to your secondary provider. That secondary provider will now tell you, you have something to benefit from the NHIA by being an enrollee. So he now refers you to any that I've just listed. Now, the referral must be made within a respective geopolitical zone. If you look at those hospitals that I listed just now, they represent geopolitical zones in the country. University of Benin, South-South, University of Nigeria, Nsukka, Southeast, UCH, Southwest, like that. That is the geopolitical zones they represent, so that you don't have to travel too far to access those benefits. At this time, I want to say thank you for listening and to get in touch with us at any time. So thank you. I think I will get back to, I will have to go off screen now.
Yeah.
And we'll get back to our presentation. Thank you so very much for listening. So these are what you stand to benefit by enrolling on the NHIA gift ship program. Thank you.
Thank you so much, Dr. Abraham. My team, please, can we just celebrate this man? Let's just type 777 to just celebrate him. He has wowed me. He has given me information. I've met him before, but the information I have tonight is beyond what he gave me when I met him in his office. This is awesome. Please, let's just put 777 there. to just appreciate what we have heard today. Now, I know many of us have questions. And please, if whatever you are asking or you want to ask has been asked by someone, please defer it. You don't have so much time. But what you need to do now, you need to raise your hands, and I will make our president, Mr. Lushula Popola, is available. He will moderate this part of it right now. So please, if you have questions, what you need to do, you need to raise your hand so that we can do this orderly. And please, no story. You remember, we have quite a lot of people that might want to ask questions. No story, just go straight to the question you want to ask. It's an awesome night. Dr. Abraham, I know that this is supposed to be just for 30 minutes, but you can see that this is powerful. We had almost 100 people in the house at some point. And so please just give us a little bit more time so that we can get our team.
No problem.
All right, Mr. Popola, you can take over. I want you to moderate this part of it, sir.
Awesome, awesome, awesome. Thank you very much, Mr. Kolumaje. And Dr. Abraham,
Okay, please. I want us to mute ourselves. Hold on. Mr. or Miss Odeyemi, please let's mute ourselves. Just you will be asked to mute yourself when you want to ask your question. So let's remain muted so that this will be orderly. Thank you so much. You can also send your question. You can type it in. You can type your question in, please. All right.
All right. Thank you very much. It's Dr. Abraham. We want to say a big thank you for carving out time for this meeting. I know you've been on some series of Zoom call. You know, it's a national call, and that's why my people are so excited about being on this. So quickly, so that we can give him time for him to move on, we can do other things. Let's quickly address one or two questions. Now, somebody said, is there going to be constant training on this? Of course, we have the masterpiece. We've recorded this video. So this is going to be on our YouTube page so that if you need to go over it again, you can go over it. It's not every time you get these top directors coming on
high profile.
High profile. So please, we are going to put this up on our site so that and we drop the link in our members group so that members can go listen to it again. What is Richvision doing for all members to benefit from this? Okay. When we get to that level, somebody said, what is age limit? He just told us that age limit from birth to the highest level. He said a child up to 0 to 12 weeks is covered by the NHI insurance policy of the parents. And after that, the child can be registered up to old age. There's no age limit. Okay. Joy is saying, concerning emergency handling by NHI, will there not be slow process to attend to the emergency? Well, I think doctor will take note of that. Don't let me dive into that aspect. Doctor, I hope you getting us. Somebody saying concerning emergency handling by NHI. NHI, by the way, does not handle the emergency. It's a hospital. They will know that you are registered. But I guess what this person is trying to say is that if I get to if someone gets to the hospital and is an NHI enrollee, will they attend to the person quickly in case of emergency? Doctor, please help us take note of that. Now, what is Richvision doing for all members? I'm going to go to that. Let's allow doctor. Okay, Salami is saying, please, Dr. Abraham, is it all drugs that money will be shared between NHI and the patient? Please, does treatment cover enrollees' family members? Quickly, I think that's one I understand what the doctor has said. It's not all drugs that is shared. And I think he did mention, I don't know whether I mentioned it here, that the drugs, you only pay 10% of the cost of the drugs administered to you in the hospital. It's for those high profile challenges. He called something, I think he's going to, let him talk about that. Don't let me delve into that. Okay. Please, does the treatment cover enrollee family? Each family member is registered. Each family member is registered individually. You remember him saying that if you are 9, if you are 5, that is 5 times 15,000, that's 75,000, and so on. Someone say any package for the family. As he said, it's individual registration. The only one that is covered for a child is when the child is 12 weeks, less than 12 weeks old. All right. So your office and address, please. Don't worry. You will get across to Richvision where we help you handle that aspect. So, doctor, I don't know, would you want to just quickly answer those ones that I just skipped, please?
Yes, let me respond to those ones. I think I'll begin from the last one. Does the registration cover all family members? Now, if you register 5 family members, the 5 family members will have access. If you register 9 family members, the 9 family members will have access. So it depends on the number of family members that you are registering. That's what the gift ship program is about. Now, for each member of a family, if you are coming together as a family or as a group, it's 15,000 naira per person per annum per 1 year. Then the other question is it all drugs that money will be shared? Now, basically, for all prescriptions, for all drugs, except those ones that are under partial exclusion, it is 10% of the cost of the drugs that you pay at the point of service, at the point of dispensing. 10% of the cost of the drugs. Now, if a drug that is prescribed for you is any of those drugs under partial exclusion, like the cancer drugs, that one is 50-50. 50-50. Based, and the other 50%, I've told you what NHIA has done, where we have made arrangements with a pharmaceutical company that provides some of those drugs for treating cancer, where you get to pay 20%, NHIA takes 30%, and the pharmaceutical company takes the rest. So that one is what we call partial exclusion. We have drugs that are under partial exclusion, it is 50-50. But majority of the drugs, in fact, 90% of the drugs, if not more, is only 10% of the cost of the drugs that you get to pay. Now, it's a slow process in emergency. I believe you are talking about the hospital. Because if you're talking about the NHIA, once you come on board, once you register, we capture you, and your payment is made. And it's a good thing I should add here while answering this question. You will wait for 90 days before you begin to access care. That 90 days, we don't count it as part of the money you paid. It is just a window that we use for administrative purposes, to get in touch with your hospital, to get your name empaneled, to get some things that are done administratively. So for that 90 days, you will not be able to access care. After 90 days, your name comes out, and then you start accessing care. It is after your name comes out that we start counting your 12 months. Please, let's get this clearly. It's only after your name comes out that we start counting the 12 months that you are paid for. And then for the emergency at the hospital, NHIA has a policy that has been agreed to by stakeholders that are providing care for you. Once there is an emergency, your healthcare provider is not expected to start calling your HMO. For an emergency, the healthcare provider starts taking care of you immediately, while arrangement is being made to contact your HMO. And now, don't forget the definition of an emergency, that care will be given to you under 1 hour so that the person does not die. That's WHO definition. An emergency is a medical situation, medical condition that requires an intervention within 1 hour so that the person concerned does not die. That's an emergency. So when somebody is having you say I have a fever, so it's an emergency, and the doctor said it's not an emergency, just wait your turn. And no, the doctors know what emergencies are. So when you get to the hospital and it's an emergency, they start treating you while contacting the HMO. They don't wait to contact the HMO first before they start treating you. So that delay, any delay or slow process in an emergency, count it out. It's not part of what is entertained under the NHIA GIFSHI program. Now, is there going to be constant training on this? I think I will leave that to your cooperative. If you ask me, I want to engage with you frequently to, as much as possible. In fact, even after you register, to teach you your rights, to teach you how to benefit from the program, to teach you how to maximize utilization. I will have to teach you these things. So whatever you want, you can gather yourselves together, and it may not be me, it may be any of my staff, to teach you what your rights are under the program. We can't cover all that here, because that will mean I will bring another slide to teach you what your rights are. I will bring another slide, teach you all the referral process. I will bring another slide. So there are lots of slides. This is just one slide on what you benefit. So, and we don't have that time, that luxury of time to begin to cover all these. But I believe as your cooperative exco begin to arrange more of these, we will come and we'll teach you all of these once you are enrolled. And the other question about our contact and all that, it was at the end of the slide. So we can be contacted. Your ESCOs can reach out to us. And please let me add something here. If you consider that bringing out 15,000 naira at once, or you have a family of 6, bringing out 90,000 naira at once is going to be a burden on you. One of the advantages of a cooperative is that from the savings you already have, the cooperative can make your payment for the enrollment and agree with you that they can be deducting certain amounts on a monthly basis until that is done. So it makes it easier for you. In fact, we've had cases where people come and one of the challenges they have is that, how do I bring out this money at once? And we'll tell them, come together as a group, and you'll be able to do this as a cooperative, and then the deductions are made gradually. I want to assure you, no investment made into your health that will go unrewarded. No investment made into your health. Health is something, it is an intangible wealth that you have that you don't want to toy with. So I want to appeal to you, get health insurance. Apart from the law that has made it compulsory, that has made it mandatory, it is important that you have health insurance for yourself and for your family. If there are more questions and there is more time, I'm open to answer.
Okay. Thank you very much, Doctor. Please, I have some hands that are up. I will want you to just be very brief on the question. I will unmute you one after the other. Then Doctor is going to take up the questions together. All right. So, Coach Yetunde, can you just unmute yourself and quickly just straight to the point, please? Coach Yetunde Laura.
Okay. Good evening, everyone. Thank you, Doctor. Thank you, Richvision. So I had 3 questions. I think 2 of them have been answered. The last one is basically how to get started, like how to get started, right? So how do we get in touch for the enrollment immediately? That's what I wanted to ask. That's the only one that has not been attended to.
Okay, thank you very much. I'm going to take that immediately after the questions are answered. I'll show us the process. Thank you. Okay, Grace, can you quickly unmute yourself?
Good evening, everyone. Good evening. There's a question somebody write on the screen. It's part of my question. Let me ask that first. The first one, is it government or private? That's the first question. So the second one is this. You said to see your primary doctor, you don't need to pay for doctor service. Is it the same thing with when you are seeing your dentist and your optician? Does it cover that, or you have to pay for their service? Also, for instance, let's say you want to get reading glasses, or you have problem with your eyes and you need to get glasses from your optician doctor. Do you pay for the glasses, or it covers, or the insurance cover that too? For instance, you want to wash your teeth, does it cover it, or you have to pay, or is it 50-50 or 40-60 or I don't, whatever? Sorry for that language. Which other one? I've almost forgotten. Sorry about that. Also, I want to talk about prescription, doctor's prescription, like the medicine, the drugs. I discovered that most of the hospitals, they like patients buying from them, and it's way more expensive than when you go out to get it at the pharmacy store. So now, for instance, for the normal one like malaria, not the cancer one now, I think if I can remember very well, you said we are going to pay like 10%. Hope the 10% will not still be the same price that you get, the prescription outside. That is that. I'm trying to rush out the question. I almost forgot because I was attending to my baby. Sorry about that. The other one is for exams. For like X-ray, or you're going to do a blood work. Do you also pay for that, or you pay like a co-pay for your blood work or your X-ray like that? So I just want to know, because I came in late. So that's my question for now. Sorry about that. I don't know if you get my question because I'm kind of rushing.
No,
Sorry about that.
We got it. All your questions were received.
Okay.
All right. Thank you.
All right. So doctor is going to attend to that. Let's quick Ibrahim. Ibrahim Abubakar, my professional colleague. Go ahead, sir.
Yeah, good evening.
Good evening, sir.
Doctor, good evening for this opportunity. My question, hello, can you hear me?
Go ahead, sir.
I can hear you.
My question is very brief. And the question is, if someone was earlier under a paid employment, and that person has lost his job, and he still wants to continue and maybe making his payment to cover himself and his family, how can that person go about that? That's question number one. The other question is about drug. Myself, I was made to understand that certain drugs, like for malaria, it will tell you like augmentin is beyond certain threshold, only 5,000 as such, it's not covered by NHIS. BP drugs, which is a common disease in Nigeria, except for what doctor is saying now, I don't know if it's just a recent thing that's happening. You can't even get access to that kind of drugs from NHIS. And thirdly, some hospital will just give you some kind of drug that are so cheap, maybe because of cutting costs. I don't understand. Meanwhile, maybe you already done your own, you have your analysis, they'll say, okay, this particular drug for your BP, for your typhoid, for instance, you've done your culture test, you know the one that is specific to you. They will want to follow that, just give you what they have. I don't know if they are not achieving the aim of getting good quality healthcare. Those are my questions, sir. Thank you.
Okay. All right. I think doctor is going to attend to all those questions except for the one of whether you retire. You are joining the program through the Richvision Cooperative, and in the cooperative you don't retire, you only refire. All right, doctor, go ahead, sir.
All right. Let me begin from the last one. You have talked about retiring, so that you don't retire from the cooperative. In fact, one of the things we do for those who retire from maybe any job where they have had health insurance and then they retire, one of the things we'll tell them is look for a way to get back on health insurance so that whatever pension or whatever you are collecting will serve the purpose it should serve for you and not going into ill health. Let it serve the purpose it will serve for you. Then they talked about the issue of the drugs. Now, the drugs, for majority of the drugs, like I said, over 90% of the drugs, you only make a co-payment of 10%. Now, this co-payment of 10% is put there by the NHIA to prevent abuse. It's put there by the NHIA to prevent abuse. Now, and it applies to all our drugs except the drugs that are under partial exclusion. Now, as to that, some of the drugs are cheap, and I can't remember the language you use exactly. I will explain something to you. There is what you call branded drugs, and there is what you call generic drugs. Some of you may be aware. Now, when it comes to the branded drugs are produced by pharmaceutical companies that made research into the discovery of that drug. Now, they are given a time lag within which to sell that drug and make their money back. Once that time expires, other pharmaceutical companies are now allowed to produce that same drug. And don't forget, these other pharmaceutical companies that are now allowed to produce that same drug did not spend the money in research that first company spent. So they are only coming to take cost of production, produce the drug, and put it in the market. Whereas the earlier one, both cost of production, cost of research, and all that goes into the drug. That is the reason why the branded ones are very, very expensive when compared to the generic ones. The generic ones are not fake. The generic ones are not worthless, even though they are cheaper than the branded ones. So I'm just explaining this to you. Any professional in NAFDAC, any pharmacist can explain this to you, the difference between the branded and the generic. So coming to the question of, I think I have somebody that talked about yes. Now, when you see your GP, you don't pay for card, you don't pay for hospital card, you don't pay consultation fees. If your GP refers you to see a specialist like the dentist, like the psychiatrist, like the ophthalmologist, you don't pay consultation fees. NHIA takes care of that. And then the services that are given to you, for example, the scaling and polishing, you don't pay for it, not even 10%. So even the laboratory investigations, you don't pay for it, not even 10%. That 10% applies to drugs alone, drugs that are not under partial exclusion. That's what it applies to. I hope we understand this. So for the laboratory investigations, for the services you enjoy from the health professional, you don't pay for it. NHIE pays for those services. Then he talked about the 10%. He said, hope the 10% will not be equal to what you would have bought it outside. No, there is a tariff. But I say tariff, I mean there is a list of drugs and the prices of those drugs. So if in that list of drugs and the prices, the price of a drug is 1,000 naira, what it means is that if that drug is going to be dispensed to you, you will pay 100 naira, not 1,000 naira. I hope this one is clear. So, and that 10% applies to drugs alone, not to laboratory tests, not to the services or that maybe the scaling and polishing and other services you enjoy at the hospital. So I hope that is clear. Then he said, somebody asked, is it government or is it private? National Health Insurance Agency is a government agency that is established by an act of the National Assembly. And it was mandated to promote health insurance, to regulate health insurance, and to integrate health insurance in Nigeria. That act mandated the NHIA to set up a scheme that will provide health insurance for all government workers and other relevant groups. You fall into that relevant group as a cooperative. So we'll provide this health insurance to you. So we are government, we're not private. But then don't forget, the act also says for any individual that feels what government is providing, the government health insurance, whether from the NHIA or from the states, because the states are, by that act, has also been allowed to provide health insurance. When you are not satisfied with what is being provided by the government health insurance, you can now go to the private health insurance and get what we call complementary or supplementary or top up. The easy language is top up. That would, for example, there are things I mentioned that I said they are excluded, they are not covered. And HMO cannot provide it for you and you will pay. Are you getting this now? So the private HMOs provide top ups. Then how to enroll, I think we have explained that before, and we will keep explaining it as much as we can explain it to you. So you coming as a group is 15,000 naira per person per annum as a group. If you want to come as an individual, it is 45,000 naira per person per annum. But we'll allow you to add. Am I still audible?
Yes, you are here. You are here.
Yes. Okay. So I think I've covered the questions that have been asked here. Okay. Somebody also mentioned the issue of glasses. For the glasses, you don't pay 10%. The glasses are covered by the NHIA. What NHIA does not cover is that frame. Because sometimes they give you the glasses and they tell you to select a frame. If you select a frame of 100,000, you are the one that will pay for it. So just tell them, NHIA says simple frame. Give me a simple frame with the lenses, and NHIA is responsible for the payment. You don't pay 10%. NHIA covers that. NHIA will pay for the glasses. And then I think that does it. Those are the questions asked.
Doctor, just a quick one. Just quickly address those people that think this is for Lagos people alone. Quickly address that, sir.
Okay. Now, National Health Insurance Authority is present nationwide. As we have a state office in every state of the Federation and the FCT, we also have healthcare providers in every state of the Federation that we have accredited. In fact, we have close to 10,000, if not more than, if I can tell you that, aggregate all the healthcare providers that we have accredited across the nation. We have that number. In Lagos alone, we are doing at about 2,000, if not more, healthcare providers, hospitals, clinics that are accredited by the NHIA, and they are spread across all the local governments in Lagos and in other states. So you can choose your healthcare provider. Once you are going to do the enrollment, we will give you the list. You will see the list of the healthcare providers. The list of healthcare providers in Ogun State will make it available to you. The list of healthcare providers in Edo State will make it available to you. The list of healthcare providers in FCT, if you have members there, will make it available to you. So your members will fill the form, fill the healthcare provider they want, and send that scanned filled document to us. And that is when we'll start doing the enrollment. So we have healthcare providers spread all across the country. And like I said earlier, if your healthcare provider is in Lagos, you chose a hospital in Lagos, and please take note, we have both private healthcare providers and public-owned health hospitals as accredited healthcare providers under the NHIA. It may surprise you to note that the 2 teaching hospitals in Lagos are accredited by NHIA, LUT and LASUT. It may surprise you to know that over 80% or close to 90% of the general hospitals in Lagos are accredited by NHIA. It will also surprise you to note that a lot of the private hospitals in Lagos, a lot of them, I will not be mentioning names here, are accredited by the NHIA, and you can choose them to access healthcare anytime. So the same way we have the private and the public-owned hospitals accredited by NHIA in Lagos, we have the same replicated in Ogun State, we have the same replicated in Ondo, in Oyo, in Ekiti, like that. So the numbers are massive. They are massive when it comes to the number of healthcare providers accredited by NHIA for you to choose from.
All right, sir. Thank you very much for that exposition. We really appreciate you on this. As much as possible, we'll have loved to take more questions, but because of time, and we need to get some people informed on how to get their registration done. This program is brought to you on the auspices of Richvision Cooperative. And for why do you need the cooperative? Just like you said, you can go register as an individual, but why do you need the cooperative to help you in this? As a body, you know, they say we are stronger together. So as a cooperative, we do more research in getting a very good HMO for you so that we are under one big umbrella. Now, one of the things that those of us in the cooperative will enjoy is this. You see, at times, when you do it as an individual, you may not know, you may not even remember when your application expires at the end of the year. You may not have cause to use it throughout the year. Maybe it's when something expires. That's when the person has some challenge and it now goes to the hospital. They now say it's no longer registered. But as an organization, our systems are automated, so we can always help you track it. Now, number two, for those people that are members of the cooperative or would be members of the cooperative, because you want to be, we'll be supporting you as long as you are members of this cooperative. Many of us want to start now. As long as you're a member of this cooperative, I can assure you there's a provision at the back office. You know, at your back office, you have your login details. You can log into the back end and you can access the facility immediately. Do you understand? You can access it immediately. I'm trying to bring this up. Now, I hope is my screen showing here?
Yes, I can see it now.
Okay,
yes.
All right. So if you go to the back office, there's a place there, you are going to see NHIS Health. Although we're changing this name, is NHIA, not NHIS. Now, you see enroll to enjoy our healthcare insurance program with NHIA. Note this is an annual subscription of 15,000 naira. It can be paid at once or spread over 15 or 5 months as aided by the cooperative. So you come in, this person and the user ID is here already. All you need to do, come to your back office. There's no story here. Come to the back office, click which one do you want? Do you want the monthly installment? The monthly installment, if you choose this, that means you want to be paying at 3,000 naira monthly. No problem. We are not going to say until you finish paying. Monday, if you fill the form, if you complete filling the form by Monday, cooperative is going to pay the 15,000 naira straight to NHIA. So we are not waiting. You could take, that's the benefit. You might not have the cash immediately. The same thing, after 1 year, you need to renew this. You don't need to, we go ahead and do it for you, but then you have the duty to pay back. Now, we have some of us that want to do it, just take it completely, let them pay from my system. Once you indicate that you need it, cooperative is going to pay. You can now pay the money into the account, into your wallet accounts to cover up the costs that have been paid. Whichever one you want to do, it's fine. Now, you now come down here. Once I've chosen this, I come down to this place. I will click on the form to download the form. That's the NHIA form. Now, it brings out a form. What you should do, please, you will print out this form. It is not, you can't fill it digitally. You will have to print out this form. This is exactly the form that we are given. You will bring out this form and fill. You will attach your passport photograph here. Now, GIFSH category, you got to leave that one. The ID number, you leave that blank whilst you fill the others. So the ones that we need to do, we are going to tell you which and which you will need to do. The primary healthcare provider that is close to you. You don't bother about the HMO. We are taking care of that HMO, all right? Those are the part of the things the cooperative is doing for you. Then you go to the primary healthcare provider, go to your environment, go to the major hospitals that you have around you, and go and ask them, do they accept NHIA? Once they tell you those are the hospitals that you are going to use, you feel it there. Whether you are living in Zamfara, in Sokoto, in Nasarawa, in Usuka, in Bayelsa, anywhere you are, look for an hospital. Just like the doctor said, a lot of hospitals and things are having it. Now, once you've done that, what you now need to do after you have filled the form, just come back to the system. There's a place, you know, if you have done this with your, if you have done this with, if you have done
forward, go forward again.
Okay. If you have done the registration, if you have done it, if you have filled this form properly, you can now go back to your system and upload. You will upload this. Just take a very good snapshot. Do you understand? Don't snap. You know, some people will want to snap a form. They will snap all the mattress and the pillow on their bed. It's just the form. Just focus if you can't do it, get somebody to do it for you professionally so that we can upload it back into our system. Once we see your form, guys, we will go ahead. Let me go to that environment. Okay. Once you fill it, you submit it. Don't do any other thing. We will go ahead and make payments. Once we've seen it from your back office, we will go ahead and make payments. Where this NHIA is on the board there. So you can see where to upload, where you can upload, where you upload and things, and then you click on apply. So it's a very simple process. But now some people will say, what of those of us that are yet to be members of the cooperative? Now this is where it gets interesting. The cooperative registered, it's just like we said, is an entrepreneur's cooperative. We are all members. We contribute to help ourselves. For those of us in the cooperative, what you do, this program is packed like health and wealth empowerment. Now, in the cooperative, you are saving. Remember, you save monthly. It's money. The same money that you have not saved will not save you. How much are you saving? So in the cooperative, you are encouraged to save 5,000, 10,000, 20,000, 100,000 naira monthly. So, and as you do so, the cooperative allows you to take two kinds of loans from the cooperative. The first loan you will have access to is what you call the in-house loan. You don't need any collateral, you don't need any guarantor for that. That you can just access 80% of whatsoever you have contributed. The other one is the guaranteed loans, where you can take 2 times. So I have contributed 500,000, I can get a loan of 1 million. And I just need 2 guarantors from the cooperative, guys. And you know the interesting thing? That loan is 100% interest-free. Again, I say it is what? 100% interest-free. Now, for more details on the operation of the cooperative, because we don't want, this is already lengthy already, we want you, if you go to our website, richvisioncoop.com. That's the site. On that site, there's a video of the operation of the cooperative. So watch this 15 minutes video. Then you need to get back to the person that invited you to this program. Anyone, there are a lot of our members that posted on Facebook, on IG, and all these things. Get back to that person and tell the person to give you a registration link. The person is going to give you a registration link, and then you get registered. Now, ladies and gentlemen, the promo that we are going to do now, one of the things we want to do now is this. For those of you that will just be registering, you've not been a member, you are not yet a member of the Richvision Cooperative before, and you want to be a part of it because of this, to enjoy this benefit. Now, what you do is, When you register, depending on the package that you take, all you need to do, we want to see your consistency. We just want to see that you are consistent for just 3 months. We want to see your consistency for just 3 months. Once we see that you are consistent for 3 months, you just pay your 3,000 naira. In 3 months, the Richvision is going to pay the totality of your insurance, of the NHIE fee for you. You have to be consistent for how many months? 3 months. Now, there are some of us that say, okay, I want to start now. I want to register today, and I will pay my 15,000 naira immediately my registration is completed. Wow, you are also welcome. Once you do your registration, you go to the back end and click on that. We have to do it in group, batch by batch. So if you're going to be doing for yourself and for your children, make sure you submit the forms. Let them follow themselves so that you can be grouped into the same hospital and so on and so forth like that. So ladies and gentlemen, we want to say a big thank you. Please, just like I said, you have to get back to that person that invited you to this call. If it's a WhatsApp or something, the person has a name there. Get in touch with them that please send me the registration link. They will send you the registration link. You get registered, you get paid. Your payment can be done. Our registration process is simple. If you see online there, after the person has given you the link, you go on it. You know, it's something like this. Please, just a minute. I don't want people to be confused on this. Let's say I came in. The person that sent the link to me is Jibore. All right. Let's say that's the person. The username of that person will be there. I punch that. The system loads. It shows me a page where I can do my registration. But I advise always take the time to watch the video that gives you the full presentation before you go ahead to do your registration. Once you've done that, you come down here and click on Join Us Today. Once you click on Join Us Today, the registration forms comes out, and then you fill the form. Let me put just quickly so that you can see the registration for the cooperative is 2,005 one-time registration, and then you select a package. What do you want to be doing every month? 5,000, 10,000, 20,000, whichever way. Maybe I want to be doing 25,000 naira monthly. Fine. I put in, I accept, I click on this, straightforward, and then I click on validate. Everything is online. Our membership spans across the world. All right. So you will see the name of the person that requested you, whichever country you are. Choose Nigeria if you are in Nigeria, and then you choose your phone number, and then you put in your username. Which username do you want to use? I use Kasali here. All right. And then the email address whatsoever I am using there. And once I'm done, I click on continue. So once you click on continue, it takes you to that portion how you are going to make your payment. Total payment is 27,500 because the 25,000 monthly registration and my registration fee. I can decide to pay via voucher, and I can decide to pay using Flutterwave. I can use Flutterwave to make my payment. When you are using Flutterwave, you have, Flutterwave is a payment gateway. So you have the option of using maybe your card or transfer. Once this is done, please, it is after this is done, then you will be able to pay your monthly contribution fee. All right. Now, there's a process that we have that we'll be explaining. The treasurer, Mr. Kule, can we permit people that want to join the cooperative for us to show them this process maybe tomorrow?
Yes, we can do that.
Okay.
We can do that tomorrow.
So that for those of you that want to join the cooperative, because we don't want, this is already lengthy, you can join us tomorrow. We will send the link again so that you can see the process of joining the cooperative, how you pay, how you open your bank accounts and everything. You will agree with me that it's been a wonderful session tonight. It's so expository.
Yes,
and I tell you, even I thought I was knowledgeable on these things, but Dr. Abraham just made me to know that we are just learning, and there are a lot of opportunities that are opened to us. Guys, make use of this. Your parents, your grandparents, your family members in your house at home. Don't wait for them to call you for emergency. Then you will now start looking for how to pay. Register them now. Those your housemaid, your house helpers and things that you have in your house. You can register them, get them on the scheme. Your church members, don't wait until let's contribute money because this person is sick. 15,000 covers a lot of things, guys. And you can help some people, a philanthropist, just put 10 people on your payroll every year. God, accept my sacrifice. I want to be helping 10 people every year on this health scheme. Please be useful to the society, be useful to God. And I pray as you do it, the Almighty God will help you also. Mr. Kule, from your end, one or two things or you want to address?
Oh, fantastic tonight. I know the time is not there, but first I want to appreciate Dr. Abraham. Thank you so much, Dr. Abraham. Thank you. Thank you. You surpassed our expectation. Of course, be ready. We are going to call you again. I know there are quite a few questions. Please, for those of you that your questions were not answered there, you are free to send these questions to the group chat that has been created. Okay, there's a group chat that has been created, the health insurance group chat. Make sure you are on that group chat. I'm sure many of us are there now. You can post your question there, and Dr. Abraham or any one of us that we understand what it is, we will attend to you there. But tomorrow, for those of you that sees reason of reasoning in what we are doing here, we want to complete this process. We thought we can do it tonight, but obviously we can't. Tomorrow, let's have a 45 minutes presentation tomorrow, and we can show you the details of how this registration can be done. I remember what I said. I know there's no time for testimony today, but I have one that happened just this week. I recommended someone about 4 or 5 months ago. She was pregnant, and I said, go and register under this scheme. And she registered herself. And that thing covered herself and the family. When she was giving birth, just on Tuesday, this past Tuesday, she gave birth via cesarean section. She paid no kobo in the hospital that she used because she was on this scheme. And I'm giving you the truth because this person is related to me. Is the wife to a brother of mine. So I know that this works. And so we will talk about this tomorrow more. At 8:30 tomorrow, we have a concluding session on this one. So, Mr. President, with your permission, we are going to send out a notice on this for tomorrow, 8:30, and then we can conclude this. Thank you very much, sir.
Awesome. Thank you very much, ladies and gentlemen. I want to appreciate all of you. God bless you. Wishing you a great celebration. Happy Resurrection Day. And hope to see you tomorrow night. For those of you that want to get started, we are going to start you up immediately tomorrow upon registration. God bless you. Do have a wonderful night rest. Bye-bye.